morning. Thank you for having me here. I was very intrigued to talk about our favorite hype theme of the days, weeks, and the past 2 years, AI, and try to connect it with the previous session, which is a game changer, to be honest. However, I decided to give you a glimpse of what is happening in Greece as we speak with the digital transformation projects of the health care sector, funded by the Recovery and Resilience Fund of the EU. Helmut von Moltke, there's no umlaut there, told that, every battle plan goes to drain when you just conduct the enemy. So maybe this is a case of everyday struggle of a very demanding program of digital transformation that goes throughout all public health sector in Greece as we speak. Usually the people are asking me, what is EY doing in a place like this? You are accountants, you are auditors. In Greece, the consulting team is 4 times bigger than the audit team. We are 2,700 people with a very strong technology arm, which I have the privilege to lead as far as government projects are concerned. So this is why we are here. And we are very privileged to be it's the mouse or the tabelakια. Δεν θέλουν, άλλαξε. Okay. So, this is the full digital health program funded by the RRF happening in Greece as we speak. This is the digital health projects only. There are other projects that also include the digital elements. So as you may see, this is a vast program that is being implemented as we speak, covering all aspects of public healthcare, including the National Digital Health Record, full digitalization of the hospitals, and many other agencies of the public sector. This is the continuation of the previous one. I will not go into each and every one of these projects. I would like just to highlight what we are trying to do there. And we have the responsibility to monitor the actions, sub-actions, and projects of this vast program. Probably all the sponsors and supporters of today's conference are the contractors. We are talking about more than 30 companies, including subcontractors. We are talking about 10 agencies, government agencies, all the public sector hospitals, 130, all the every structure that is providing public health services in Greece. So it's a very demanding project, and IDICA, the e-Government for Social Security Services, the co-organizer of this conference, is managing this full program, supporting the Ministry of Health. Just think about it. We are in Greece. It's one ministry, the Ministry of Digital Governance, another ministry, Ministry of Health. They have the e-Government of Social Security Services, another government agency that is trying to coordinate this program. So we need a coordinator of the coordinators, which will manage the program managers and the project managers and all this kind of stuff. Because this is the issue. It's not about the technology. It's not about the products. It's about people. It's not even about the processes. It's about people. Because everything, and this goes in my first quote, everything is dependent on people. And people are not only the healthcare providers, like doctors, but also the administrative staff that is in the government agencies. And this is a huge change that is currently happening. People of technology, like ourselves, are usually focused in the technology and the next new thing that will go beyond and above there. So this is the previous session that I watched. It was very, very interesting to try to put actual benefits in the hands of the end users. Because what we have been seeing in the 10 months that we are in this project is that this is what we are seeing, okay? We think that we are controlling missiles to go to the moon. The contractors that are actually doing the work think that we are just getting the money just to tell them do this, do that. And actually, every day is like the last photo. And maybe Idika is also seeing us like this, because they always want an external third party to try to govern some of the struggles that we have. So it's a very, very ambitious project that is now underway. So hopefully, in the next 2 years, the landscape of the public healthcare in Greece will be totally different than what it is today. So I have just one more slide. Mr. Kotsiopoulos was in the previous panel, was one of the key stakeholders that actually was, with his previous hat, in planning this whole program. So it's actually a very, very innovative program, which is the biggest and the most vast we have ever seen in Greece for the public healthcare record. Not only in terms of amount of money that is being spent, but also in terms of the stakeholders that are there. All this in the very, very strict timeline and milestones of the RRF. As we speak, the deadline for all these projects is the end of 2025 or early spring of 2026, which is something that it's very, very ambitious, of course. So we are trying to handle that in the best way. There are many stakeholders, there are many integrators, there are many vendors that are currently working also in other huge public sector projects. The digital transformation project of the Greek government is one of the biggest in the EU, funded by the RRF, of a total fund of more than 6 billion euro that started in 21. Actually, the tenders were out in 22 and 23, and now we are in the middle of a huge implementation in very many agencies all around the Greek government. So the same people need to have a huge capacity, same companies, same agencies, to address this. And this is something that it's a very, very key factor that will actually decide on what is the outcome. Our role there as EY is to try and assure that we get value to the society from this project. Not just to be, compliant with the contracts and the deadlines. Not just to be there in order to support, the delivery in a, tick the box approach, but to be there in order to support all the stakeholders to provide a better view for the Greek citizen on the health sector. Thank you very much.